A new mental health treatment option in Boulder is working to lower suicide rates.
The Hope Institute has already helped people stay out of the hospital for mental health crisis in other parts of the country. Your reporter in Boulder, Sarah Horbakowitz, explains how they're trying to do the same in Colorado.
The mental health resources at the Hope Institute work a little differently than the typical therapy you might be thinking of. The Hope Institute focusing on suicide prevention, and they've had success in other states, but now it's coming to Colorado.
Welcome to the Hope Institute of Boulder.
Dr. Benjamin Finlayson is the clinical director of Hope Institute Boulder, a mental health resource focusing in suicide prevention, opening with a grant from the city.
Being here is really taking a proactive look at treating and addressing why suicide is so much higher in the state of Colorado.
In their 5 to 12-week program, therapists like Alexa Waller aim to be more focused than general therapy might offer.
Spending time talking specifically about suicide isn't always an experience that people have had in individual therapy. We talk a lot about different skills for coping, distress tolerance.
And they're seeing results. The Institute says after a year in Georgia, the Children's Healthcare of Atlanta saw fewer patients coming back to the hospital for suicide, dropping from 90% of patients returning in 30 days to just 6% in 4 times as long.
I've seen the difference it can make when we talk about it. When we bring it into the room and we say, yes, you're not alone in this.
In their first 2 months, the Boulder Clinic already has dozens of patients, connecting with the city's mental health response team and CU Boulder as another option for support. Jessica Ladd-Welbert has already seen the impact with clients at the university.
Providing support for a large community, it's great to have a dedicated resource in our own city.
And seeing the difference one call can make.
Our counseling center has already made referrals to them and found them so responsive. And when I met their director, we knew that they would start out quickly and fill up fast.
The Hope Institute says they work to accept patients within 24 hours of that first call and work to make it accessible by accepting most insurance and work on a sliding payment scale for those who need it. Reporting in Boulder, Sarah Horbakowitz, covering Colorado First.